Hi, and welcome to Healing Peak Regenerative Medicine's Longevity channel. And today we're going to talk about the use of cholesterol lowering medication and its effects on musculature and joints. And I want to bring this up because I see this time and time again throughout my practice, and it's something that's come up a lot, and I think that it's really underaddressed and that there is pretty much no awareness on the patient side of things on how this could affect their lives and also their pain in their joints and their ability to recover from injury. So that's what we're going to chat about today. And I just want to start with that right now in today's medical system, it's more difficult every day to find a good primary care doctor. And I do refer my patients out to primary care doctors. And over the past few years, those primary care doctors are no longer accepting new patients. And I'm usually referring people to a private practice primary care doctor because they tend to spend a little more time with their patients because they're able to, and they're not in a huge medical system where they need to meet a quota. And so if you're looking for a primary care doctor, it's really good to look for one that is in private practice and not in a large conglomerate if you can avoid it. And the reason for this is because of continuity of care. And that means you have one doctor that's looking at your whole health history, that is repeatedly seeing you over the years with all your records in one place and knows what medications you're on and managing those medications. Because so often I have patients come in and they are on 12 medications and they don't know why, and 5 different doctors have prescribed them these medications, and those doctors only had 15 minutes to address their complaint and give them a solution, and maybe didn't see their whole chart note or didn't know they were on all those medications. Some patients can't remember that they're on 10 medications. I mean, honestly, who could? And so eventually some of these patients who are really, diligent and looking for answers end up in my office, and then, I'm going through, they're wanting injections, platelet-rich plasma injections or prolotherapy injections, and I'm looking at all of their history going, this is not prolotherapy and PRP are not what's going to help you, So usually what happens is I've gone over all those meds, and this just happened to me this week, and so it's why I was so eager to bring it up to you, is that a statin medication or a cholesterol lowering medication can have a long-term side effect. It doesn't happen right away. It can even happen years after you've been on it. You could be on this for 5 years and then the side effects start, which is most of the time low back pain and hip pain, especially while sitting for long periods of time. And so then these patients start to get massages or go to the chiropractor, or they go to the doctor and say, hey, I'm having a lot of pain. And the doctor prescribes them gabapentin or something for gout or a muscle relaxer or all of the above, when really they just needed to get off their cholesterol medicine. And I am not saying that you should get off your cholesterol medicine without talking to your doctor first. You should always, always, always talk to your doctor before you stop taking any medication that you've been prescribed, but find a doctor who's willing to help you go through that process. And the only way that you can really get off these medications is if you change a lot of the behavioral stuff that I've gone over a little bit in the last few videos. And so usually with these patients that come in with chronic low back pain and hip pain, and then I look at their med list and they've been on a statin forever, we do a 30-day trial, but we also do a 30-day trial without that medication, but we also do a lot of other diet changes to make sure that their cholesterol is coming down dramatically during that time that they're no longer on that medicine. And so that is a variable that is difficult to control, because it could be that they're just eating a less inflammatory diet, and that's helping too. But we, in pain medicine or in joint care medicine use, it just comes up a lot. And then the other thing I would say that I've noticed is that if someone's coming to me for an acupuncture visit related to a car accident or is a referral from another doctor, so I'm not managing the rest of their care, and I really am just there to treat this condition that they were referred to me by for acupuncture, and they're not getting better, and I know that they're on a statin, then I will also, contact their primary care doctor or the person who's referred them to me and mention that to them, as a potential thing that they could do, because it seems that people who have been on statins for a long period of time really just don't heal well from injury. So car accidents, falling off ladders, whatever it may be, if you've been on a statin or cholesterol lowering medication, a lot of people don't know what statin means, then the likelihood that your body's going to have a harder time healing from injury is very high. And I just wanted to bring this up because so many people are on this medication, and it's kind of like the cortisone injection. It's a really useful drug to have 10% of the time. But most of the time, these things can be managed with diet and lifestyle or another type of therapy that is way less detrimental to the person. And there is a small percentage of the population that just produces a lot of cholesterol and also inflammatory markers, and that part of the population could use a statin in a specific way. As long as they're managing their diet too, we can keep them on a really low amount that will do a lot of work because they're doing all this other stuff. And so I wanted to bring that up. Cholesterol is one of those I have a big bone to pick with how cholesterol is managed in typical medicine, because most of the time, like I said, it can be managed with diet and lifestyle, and most of the time it's really looked at like it's like when you look at a cholesterol panel, you see the total cholesterol, you see the HDL and the LDL, and occasionally you'll see a VLDL. I always run a VLDL. All this is different sizes of fat globules in your bloodstream. Some are more dense, some are less dense. And the high density lipoprotein is your good cholesterol, or deemed good cholesterol, because it's trying to make itself more dense. It's going around your bloodstream and collecting other fat globules and bringing them back for use to the liver or excretion. And LDL or VLDL are low density lipoproteins. So you can just imagine you have different sizes of balls, like a golf ball, a baseball, a softball, and they're all different types of fat globules, and they're all circulating around your bloodstream. And the lower density lipoproteins or molecules, they are more highly oxidizable, meaning they are more likely to become like Velcro and attach to your arteries. And that's where we get concerned about high blood pressure and heart attack and stroke. But that only happens if these molecules are being oxidized on a regular basis. And there's inflammatory markers that are very easily testable by blood, that there's probably about 6 or 7 different inflammatory markers that could easily be tested. And if those inflammatory markers are not elevated and you have a high HDL level, meaning you have a great ratio between your good and bad, although bad is good, so don't get stuck on that. Good, so HDL and LDL level, if you have a good ratio between the two of those and no inflammatory markers, and your cholesterol is over 200, I really don't care. I start to care when it gets over 240, but that's the last thing that I'm looking at when I'm looking at cholesterol levels and how to manage cholesterol. And a lot of people are put on statin medications whenever their cholesterol goes above 200, even though their HDL levels might be well into the 80s and their LDL levels are only slightly over that upper level 100 marker. And it's really unfortunate because of how many side effects there are to statin medications and how easily it could be managed with a little bit of patient education around diet and exercise. And so that is something that I just wanted to talk to you all about today, because I want more patients to be aware of the effect that this medication can have on their overall joint pain and ability to heal from injuries. Because mostly we've talked about pain. And in the future videos, we'll talk more about prolotherapy and PRP and exactly what those treatments are. But because that came up this week, and most likely this person who's been suffering with pain for years is going to be out of pain because we're going to remove one medication and change his diet. And it's just really, it's upsetting to me that this person has been in pain for so long when really this is all that needed to happen. So that's all for today. Thanks for joining me. And if you like these videos or you like this channel, please subscribe. And you can also follow me on Instagram at Dr. Amber Nixon. Thanks. Have a great weekend. Bye.